Hi, I'm Dr. Jeff Eggert with Primary Ultrasound, and this morning I want to show you an ultrasound which we think is a major advance. The SUI APOGEE 1100, the most affordable color portable Doppler on the market today. Wonderful ultrasound. With this you can do vascular evaluation of the carotid, you can evaluate for peripheral arterial disease. It also has broad applications in primary medicine. We can do several types of examinations: gallbladder, thyroid. We can evaluate the liver for fatty liver, or evaluate the kidneys for enlargement. In gynecology, we could do evaluations of the uterus or the ovaries. This same ultrasound is also quite advanced for obstetrical applications. It can do 3D and 4D ultrasound. It has some major advantages over some of the earlier machines. If you look in the past, many of you in primary medicine understood that ultrasound was very valuable, but there were problems. In the past, ultrasound machines were very expensive. They were quite large. For example, this ultrasound. This is an earlier console model. It weighs about 300 pounds. It's difficult to move this around. And so you would have to have a separate examination room just for ultrasound. The image quality in some of the early machines was a bit difficult to read at times, so you need a sonographer. Whereas with the more modern machines like the SUI APOGEE 1100, the image quality is excellent. Many of the ultrasound examinations, a primary care physician can do them himself. That's the way it is in most parts of the world. It also is highly portable. You can move this ultrasound from room to room and take it to the patient where it's needed. Another thing about this SUI ultrasound is it's highly reliable. The manufacturer provides a 2-year warranty for this ultrasound, and you can extend it for an additional 3 years. So it's reliable, it's affordable, and it has great image quality. I'd like to show you how you could use this in primary care. For example, suppose a patient in their 50s came to you and the concern was atherosclerosis. Well, you could do risk factor analysis, but still we really don't know exactly how much disease is there. But with the SUI APOGEE 1100, you could look in his carotid artery and measure atherosclerosis. I'll show you. Now, in this first black and white view, I've taken a picture of the carotid artery in the upper portion as it nears the bifurcation. At that point, flow is turbulent, and that's where plaque will first form. The wall is initially thickened, and I can measure that as the carotid intimal medial thickness. For example, I just measured 0.12 centimeters. That's thicker than most men my age, so I have some early atherosclerosis in the carotid system. It also raises concerns about what's going on in my coronary arteries. I think I better take my Simvastatin. Now, in addition to a simple measurement of the intimal medial thickness, we can also look at color Doppler flow and measure the blood flow itself. I'll show you how this is done. Now, in this view, you can see the blood flow very easily. If you will use a monitor like this in your exam room and let the patient see the blood flow, when there's plaque present, it's extremely impressive for the patients to see that. When the blood flow passes over the plaque, the patient suddenly realizes how important it is to control their risk factors. It's really been very, very helpful with that. We can also measure spectral wave analysis. So you can see it's quite easy to examine the carotid system. When you use color and you also obtain a spectral analysis, that's also a billable procedure, carotid duplex exam. That's really helpful in primary care. This same color Doppler ultrasound has such broad applications in primary care. You could use it to evaluate for peripheral arterial disease. And of course, you could use it for evaluation, as we talked about, in the gallbladder or the liver, or in gynecological applications. If you're an EMT and you wanted to do a biopsy in the neck, it would be so helpful to have that picture where you can see the blood vessels adjacent to the lesion that you want to biopsy. Or if you're an endocrine and you want to biopsy the thyroid, you know that carotid artery is just immediately adjacent. It would be so helpful to have a color Doppler ultrasound such as the APOGEE 1100 in your practice. This is the most affordable, very reliable, excellent image quality ultrasound that we think for the price today. It's also very easy to manage your pictures. You could use a simple printer such as this, or you could send the pictures to a USB port, to a flash drive like this. I particularly prefer this method. I can take this flash drive and put it into any computer and review those films. I can also show them to the patient. One of the things I like to do is look at carotids over 2 to 3 year intervals to see if there's any progression of disease. Also, you notice I'm using an additional monitor. We think that's very, very helpful in a primary practice so that patients can see what you're evaluating. The SUI APOGEE 1100, the most affordable, portable color Doppler, excellent warranty, highly reliable, great pictures. Many examinations can be done by the primary care physician himself. We think this is a major advance, and we'd like to do what we can to make it available to your practice. If you have any questions, just give us a call at Primary Ultrasound. Our number is 843-421-2164. Or you can reach us on the web at www.primaryultrasound.com. Thank you.